Your body is always talking to you, sending whispers long before it ever has to scream. But what if we've all been taught to ignore the very whispers that are trying to save our lives? The line between a 60% chance of survival and a terrifying 6% chance is razor thin, and it's drawn by one thing: knowledge. If you skip through this, you will miss the specific patterns that distinguish a simple annoyance from a life or death signal. This conversation could change everything. Let's begin. The obvious clues. Let's start with a symptom so common, it's the ultimate master of disguise: a persistent cough. I'm not talking about the kind of cough you get with a cold that hangs around for a week or two. This is different. This is the cough that becomes a new part of your daily soundtrack. It starts as a dry, annoying tickle. You blame it on allergies, a change in the weather, a bit of dust. You try cough drops, tea with honey, maybe an over the counter medicine, but nothing really touches it. It just lingers. What makes this cough so sinister is how perfectly it mimics those harmless issues, giving you every excuse to delay asking for help. Here's the pattern that should make you pause. The lung cancer cough often has a rhythm to it. It might get worse at night, interrupting your sleep and leaving you feeling drained. But the most dangerous part is how it can seem to get a little better for a while. It might fade for a few days, giving you this false sense of relief, a moment where you think, oh, good, it's finally gone. And then it comes back, maybe a little deeper, a little more hacking, a little more persistent than before. This pattern of coming and going, this cycle of false hope followed by a worsening return, is one of the most critical red flags your body can send. Research shows that while a normal cough from an infection typically resolves within a few weeks, this type of cough can persist for months, quietly becoming the shadow in the background of your life. And here's a sobering thought. For up to 3 out of every 4 people diagnosed with lung cancer, this was the symptom they had, the most common and the most ignored. Now, let's talk about your breath. You walk up a flight of stairs and find yourself a little winded at the top. You're carrying in groceries and have to pause to catch your breath. It's so easy to just chalk this up to being a little out of shape, or maybe just a natural part of getting older. But shortness of breath is the next major clue. And its true danger lies in how incredibly gradual it is. You don't just wake up one morning suddenly unable to breathe. Instead, it creeps into your life so slowly that you begin to unconsciously adapt to it. It's a terrifying subconscious negotiation you make with your own body. First, you stop pushing yourself as hard at the gym. Then you start taking the elevator instead of the stairs. Soon, even just walking to the mailbox feels like an effort. You are accommodating the disease without even realizing it. What's actually happening inside your chest is deeply frightening. A tumor can act like a roadblock in your airways, physically obstructing the path that air needs to travel. At the same time, fluid can start to build up around the lungs, which is like trying to breathe with a heavy weight pressing down on your chest. People who have gone through this describe the feeling in hauntingly similar ways. It feels like you're constantly trying to breathe through a tiny straw, or that you can never, ever get a full, satisfying breath of air. More than half of all people diagnosed with lung cancer experience this, and yet it's so often misunderstood. The tragedy isn't just the feeling itself, it's that we so often find perfectly logical excuses for it until it's become a five-alarm fire. And that brings us to chest pain. When we think of chest pain, our minds often jump to the dramatic heart attack in the movies kind of scene. But the chest pain associated with lung cancer is rarely like that. It's far more deceptive. The National Cancer Institute describes it as a dull, constant, aching kind of discomfort. It's the sort of pain that's incredibly easy to confuse with a pulled muscle from the gym or even a bad case of heartburn. But this pain has its own unique signature, and you need to know what to listen for. It often gets worse when you take a deep breath, when you cough, or even when you laugh. It can start as just an occasional faint twinge, but over time it becomes more constant. A key detail is that it's often located on just one side of your chest, typically on the same side where the tumor is growing. For some, it can feel like a sharp, stabbing pain that comes out of nowhere, but for most, it's that deep, gnawing ache that never fully goes away. This pain can also radiate, sending signals to your shoulder or down your arm, making you think it might be arthritis or a pinched nerve. The reason this happens is simple and mechanical. As a tumor grows, it can become large enough to press against your ribs, against sensitive nerves, or other structures in your chest cavity. The larger it gets, the more it pushes, and the more constant the pain becomes. It's not just a feeling, it's a physical signal that something inside you is running out of room. Whispering warnings. Now, let's move to a symptom that most people would never in a million years connect to their lungs: a change in your voice. Your voice might start to sound hoarse, raspy, or noticeably weaker. You sound like you're trying to talk through a case of laryngitis, but it just doesn't go away. This isn't just a random occurrence. There's a fascinating and frightening reason for it. Deep inside your chest, a delicate nerve called the recurrent laryngeal nerve loops down from your neck, passes near your lungs, and then runs back up to control your vocal cords. Think of it like a delicate electrical wire. A lung tumor, especially one located high in the chest, can press on or invade this nerve, disrupting the signals and paralyzing one of your vocal cords. The result is that hoarse, breathy voice. What's so incredibly dangerous about this particular symptom is how easily we dismiss it. We blame allergies, acid reflux, or just yelling too much at a sporting event. We try home remedies, we rest our voice, and we assume it will pass. But the hoarseness related to this nerve compression has a persistent quality. It doesn't respond to the usual treatments. In fact, a study in the Journal of Thoracic Oncology found that this can show up in nearly 1 in 5 lung cancer patients, and sometimes it can appear months before any other signs like a cough or pain become obvious. It might start so subtly that only you notice it at first, that feeling that your voice just doesn't sound quite right. But it's a critically important clue. Next, let's talk about weight. For many people who have struggled to manage their weight, noticing the numbers on the scale go down can feel like a victory at first. Your clothes start to fit a little better, you tighten your belt by another notch. But what if you haven't changed a single thing about your diet or your exercise routine? This is what we call unexplained weight loss, and when it's connected to cancer, it is not a positive sign. Studies from Cancer Research UK show that this happens to a staggering 60% of people with lung cancer. We're not talking about losing 5 pounds. We're talking about a significant unintentional loss of more than 5% of your total body weight within just 6 months. This isn't the result of your hard work. It's a sign that your body is in a state of emergency. Here's why. Cancer cells are greedy. They are metabolic thieves that consume enormous amounts of your body's energy and steal nutrients away from your healthy tissues just to fuel their own growth. It's like a fire raging inside you that is burning up all your body's calories even when you're just sitting at rest. The cancer can also trigger the release of substances that completely hijack your metabolism and kick it into overdrive. This rapid weight loss often comes with a tag along symptom: a loss of appetite or changes in how food tastes. Suddenly, your favorite foods might taste like metal, or you just feel full after a few bites. It's a vicious cycle that can quickly deplete your body's strength and leave you feeling frail. When family or friends start commenting with concern on your appearance, it's time to listen. And that feeling of depletion leads us to our next point, which is one of the most common and most debilitating of all: fatigue. And I have to be crystal clear about this. This is not the kind of tiredness you feel after a long day of work or a poor night's sleep. This is something else entirely. It's a profound, overwhelming, soul crushing exhaustion that does not get better no matter how much you rest. The National Comprehensive Cancer Network's research shows this affects up to 95% of people with lung cancer. It is the rule, not the exception. Patients describe it as an exhaustion so complete it feels like a lead blanket has been thrown over their entire existence. The reasons are twofold. First, as we just discussed, the cancer cells are stealing your body's fuel. But secondly, lung cancer can also interfere with your body's ability to produce red blood cells, leading to anemia. With fewer red blood cells, less oxygen gets delivered throughout your body, starving your muscles and brain of the very thing they need to function. This fatigue often comes in unpredictable waves. You might have a few hours where you feel relatively normal, followed by a sudden crash of overwhelming exhaustion that leaves you unable to do anything. And what's particularly concerning is that it's not just a physical feeling, it's a cognitive one too. People describe a debilitating brain fog, a frustrating difficulty with concentration that makes simple tasks like reading a book or even just following a conversation feel impossibly challenging. It's more than just being tired, it's your body's entire energy system shutting down. Alarm bells. We're now moving into symptoms that are less subtle whispers and more like loud, unmistakable alarm bells. The first one is coughing up blood. I know this sounds terrifying, but it's a conversation we need to have. Even the smallest amount should never, ever be ignored. According to the Cleveland Clinic, about 1 in 4 lung cancer patients experience this. And it doesn't always look like you might imagine. It might just be a few tiny, bright red streaks mixed in with your normal mucus. It could appear as rust colored specks, or it might just give your sputum an overall pinkish tinge. Some people notice it when they cough up small clots or just see a little blood on the tissue in the morning. This is happening for a very direct physical reason. As a tumor grows, it's building its own network of fragile, abnormal blood vessels. The simple act of coughing can cause these delicate vessels to break, or the tumor itself can start to erode through the healthy blood vessels within your lung tissue. The irritation and inflammation around the tumor also make the vessel walls more fragile and prone to bleeding. It's important to understand that the amount of blood you see does not necessarily line up with how advanced the cancer is. Even a tiny early stage tumor can bleed. Any amount, no matter how small, is a direct signal from your lungs that something inside is damaged and requires immediate medical evaluation. This is not a wait and see symptom. This is a call your doctor today symptom. Next is a pattern that requires you to become a detective of your own health history. Frequent lung infections. It's normal to get a bout of bronchitis or even pneumonia once in a while. But what if it keeps happening over and over again? And more importantly, what if the infection always seems to settle in the very same part of your lung? The American Lung Association has highlighted this as a major early indicator. Here's what's happening. Imagine a tumor is like a rock blocking a stream. It obstructs one of your airways, and the area behind that blockage can't drain properly. It becomes a stagnant pool, a perfect breeding ground for bacteria to accumulate and multiply. Your body's normal cleaning mechanisms can't get to it. So you get an infection. Your doctor gives you a course of antibiotics, and you feel better for a little while because the antibiotics killed the bacteria. But the rock, the tumor, is still there. So a few months later, the bacteria builds up again in that same stagnant area, and you get another infection in the exact same spot. This dangerous cycle where a patient and their doctor are so focused on treating the repeated infections that they fail to investigate the underlying cause can go on for months or even years. This is especially true for smokers, whose coughs and infections are often just attributed to their smoking habit. But if you find yourself in this cycle of recurring infections, particularly in the same area of the lung, you must ask the question, why does this keep happening? What is causing the blockage? And that concept of blockage leads directly to our next sign, wheezing. We usually associate that high pitched whistling sound when you breathe with asthma, especially in kids. But research in the Annals of Internal Medicine reveals that the new onset of wheezing in an adult, especially someone over 40 who has never had it before, can be an important early sign of lung cancer. The mechanism is the same as the recurring infections. The tumor is narrowing an airway. As air is forced through that tight, constricted passage, it creates turbulence, which produces that characteristic whistling sound. Here's a crucial clue to listen for. Wheezing related to asthma usually affects both lungs, making your whole chest feel tight. But cancer related wheezing often affects only one side of the chest. It might be more noticeable when you're lying in a certain position, and unlike allergic wheezing, it tends to be more persistent and get progressively worse over time. Instead of coming and going with certain triggers, it's another sign of a physical obstruction that shouldn't be there. Beyond lungs, the last few signs we're going to talk about are clues that the cancer may have become more advanced and is beginning to affect other parts of your body. The first one is something you might notice when you look in the mirror one morning, swelling in your face or neck. This isn't just normal puffiness, it's a condition called superior vena cava syndrome. To understand this, imagine the superior vena cava as the main superhighway that returns all the blood from your head, neck, arms, and upper chest back to your heart. A tumor, particularly one in the upper part of the right lung, can grow large enough to press on or squeeze this major vein shut. This creates a massive traffic jam. The blood can't get back to the heart, so it backs up, causing that telltale swelling and puffiness in your face, neck, and arms. Patients often notice it most in the morning because lying flat all night makes the obstruction worse. As it progresses, you might feel a sense of pressure in your head, have trouble swallowing, or your skin might take on a reddish or even purplish hue. You might even see the veins in your neck and chest becoming more visible as your body desperately tries to create tiny detour roads for the blood to find another way back to the heart. This is a very serious sign. It tells you that a tumor has grown large enough to interfere with the major plumbing of your circulatory system. The next sign that cancer has traveled is bone pain. According to research from the MD Anderson Cancer Center, cancer spreads to the bones in up to 40% of advanced lung cancer cases. This isn't just a side effect, it's a sign that the disease has progressed significantly, and the pain it causes is very different from the pain of arthritis. Arthritis pain tends to be worse with movement and better with rest, but the bone pain from cancer metastases is often described as a deep, gnawing, constant ache that doesn't go away, even when you're resting. In fact, for many, it's worse at night and can interfere with sleep. It can start as a dull ache, but it can progress to become truly severe and incapacitating. The location can be anywhere. If it spreads to your spine, it might cause back pain that radiates down your legs. If it's in your ribs, it can cause a sharp chest pain that gets worse with breathing. And if it's in your hips or leg bones, it might cause a limp or difficulty walking. This is your skeleton sending a distress signal. And finally, the last category of symptoms is neurological. This happens when lung cancer spreads to the brain, which occurs in up to 25% of patients. These symptoms can be incredibly varied, depending on which part of the brain is affected, and they are often misattributed to other conditions. Headaches are frequently the first sign, but again, these aren't your typical tension headaches. They tend to be more severe in the morning, can get worse when you cough or bend over, and they don't respond well to normal pain medication. Other neurological signs can include seizures, problems with balance, dizziness, or a sudden lack of coordination. But sometimes the changes are even more subtle. They can be changes in personality, sudden memory problems, or moments of confusion. These symptoms can develop so gradually that they're easy to dismiss. Forgetting a familiar name, having trouble finding the right word in a conversation. These little moments might seem like nothing until they start to form a pattern. They are a sign that the cancer has traveled to your body's command center. Each of these 12 signs reveals the true nature of this disease. It's a master of disguise, a silent operator that hides behind everyday aches and pains. Every symptom is your body's desperate attempt to tell you that something is seriously wrong. The real tragedy is not just that lung cancer is lethal, but that so many lives are lost because these warning signals were not recognized in time. Your life is far too precious to gamble with, and your body is far too intelligent to ignore. Trust your instincts. If something in your body feels off, if a symptom persists, if a pattern emerges, please listen. Your most powerful weapons in this fight are knowledge and early action. Fear can make us want to hide, but knowledge gives us the power to act. You now have the information you need. The next step is always yours. Share this with everyone you know. It is information that can and does save lives.